Good evening, everyone. I'm Mark Hass, your Oregon State Senator. I can't believe you all came down here to see me tonight like this. It's a thrill to have someone here that I've known for a long, long time and visit our community and talk to us about healthcare and take some questions from you. And if you do have some questions, fill out one of those cards and slide it over, and our star facilitator, Alice Bartelt, will facilitate. Before we go any further, I would like to thank Beaverton High for their hospitality. It feels like the first day of school around here. I'd especially like to thank Principal Ann Irwin. I've known her for a long time. She's a great teacher and a great leader. And I'm very excited about the Irwin era for parents and teachers. And I also want to recognize and thank Superintendent Jeff Rose, who's here with us tonight. Tonight we have a man who, here before you, last week was ranked as the third most influential person in the United States on healthcare. And some of you who saw that, you know who was ranked fourth, just behind him, President Obama. In just over a year's time, John Kitzhaber has transformed healthcare in Oregon. When he took office 18 months ago, he had a vision to change the expensive and bureaucratic Medicaid program inside Oregon's borders. He had the expertise, the credibility, and the very considerable skills of persuasion to propose a different way to serve a group of 600,000 Oregonians. And he would do it by focusing on patients, not on insurance companies, not on providers, not on drug companies. And in doing so, he will save Oregon taxpayers hundreds of millions of dollars, savings that can go towards things like schools. He's saving so much money, the federal government not only gave Oregon the necessary waiver to do this, but also $1.9 billion as a down payment to keep it up and possibly develop a model for the rest of the country. I honestly don't think there's anyone in this country who could have pulled something like this off. But enough about him, let's talk about me. Yeah. I first met John Kitzhaber when he was a young legislator and I was a young reporter in Eugene. I remember the day we met because I did a story on him, and that night when his interview ran on the news, he was identified on the screen as Lee Iacocca. It really happened. Let me tell you a story, though, that very few people know. When I was elected to the State House 12 years ago, I was a new guy, freshman, in the minority, and no one ever confused me with someone who had a lot of power. But a group of Beaverton veterans came to me and asked for help. They needed $10,000 for a monument that would go in Memorial Park right down the street from here. And I was very excited and very eager. And I spent the rest of the session knocking on the doors of committee chairmen, asking for help. And they said, maybe, and they said, come back later. And I soon learned at the Oregon Capitol that maybe means no, and come back later means no way. I was crushed, though, because here were these veterans who fought in World War II, fought in combat. And they asked their state rep for help, and he could not deliver. Well, Governor Kitzhaber was watching all this, and at the end of this session, he called me into his office, told me he had money in his Economic Development Department budget for exactly things like this, for upgrading and beautifying downtowns. He didn't have $10,000, he had $15,000, and he told me to go tell the veterans in Beaverton they would get their monument. He's been a good friend to me. He's been a great friend to Oregon. Please welcome Governor John Kitzhaber. Thank you very much. I must say this is about as odd a format as I've been in, being separated from you by a pit.
and I assume it sometimes holds an orchestra. So there's a lot of room for chairs if you want to come up here. I was delighted when Mark asked me to join him for a little discussion of healthcare tonight. I think we all know this is a hugely important issue. It's the cost of healthcare is the second leading cause of personal bankruptcy in this country. It's one of the main reasons that jobs get outsourced. It's a huge burden on businesses and job formation, and real burdens on individuals and on families. Before I start, though, I just have to tell one little story about Mark. He's absolutely right. I met him back in the late 1980s, and I don't know if any of you remember this very difficult debate we were having then about organ transplants. And there's a tragic case of a young boy named Kobe Howard who needed a marrow transplant. And this whole discussion about that really led us into a conversation about how you take limited dollars and spend them in a way that gets the greatest benefit for the greatest number of people. And it was kind of a rough time, and Mark was the reporter. I tell you that story because he has a historic perspective on the history of healthcare reform in the state of Oregon that very few people have. And his understanding of what went on then, and he understands it because he reported on it and tried to make sense of it to all of you. He's carried that with him into the legislature. He's been, I think, more notably known as a champion of the environment, a champion of public education. But he's been really instrumental in taking that historic perspective and using that to actually help move the ball forward in a way that I think will be very, very beneficial for all of you. I thought I'd take just about 5 minutes and try to put the whole issue of healthcare into perspective, and then maybe we could just have a conversation about what's going on and what the road ahead looks like. I think the most important thing when we talk about healthcare is to remind ourselves what the objective of our healthcare system is. So the question is whether the objective here is to try to finance and deliver medical care, or whether the objective is to keep people healthy. And I think that most people would say the objective at the end of the day is to be healthy. In other words, healthcare is a means to an end. It's not an end in itself. And if the amount of money we spend on healthcare was directly related to health, we'd be the healthiest nation on the planet. We spend $2.5 trillion a year on medical care in our country. That's 18% of our gross domestic product. And our population health statistics are not much better than those of Cuba. So there's a lot of money that's being spent in this system that has nothing to do with health. And if we could get those dollars out and keep people healthy, we'd have resources available to spend on public education, on job creation, on helping people get out from under their mortgages, and a whole host of things that make a real benefit to our society. So in order to understand that discrepancy between the amount of money we're spending on healthcare and our actual health, we need to ask ourselves, what are the things that actually keep you healthy at the end of the day? And if you look at the things that have the biggest impact on your lifetime health, 40% are lifestyle and behavioral issues. What you eat, whether you smoke, whether you exercise, 40% are things that ostensibly we have some control over. 15% are socioeconomic issues, which have everything to do with a person's ability to lead a healthy lifestyle. If you live in a neighborhood where the only thing you can get is a Big Mac, you don't really have the option to live that healthy life. 30% are genetics. 10% is related to the U.S. medical system. So think about that for a minute. 90% of what keeps you healthy over your lifetime has nothing to do with our healthcare system. 10% of your health is related to the healthcare system. And usually that's money that's spent when you're already sick. So if you look at where most of the money is spent in healthcare today, in the system, where most of that $2.8 trillion is going, it's going, 80% of it is going to people with one or more chronic illnesses like diabetes, or asthma, or congestive heart failure, or depression. That's where most of the money goes. And 10% of the population consumes about 70% of the healthcare dollars. So if you could figure out who those 10% of the population were, and figure out a better way to take care of them, to keep them from getting sick, you'd save a whole lot of money. So we know a lot about chronic diseases. We know, first of all, that most chronic diseases are preventable. So diet contributes about 90% to type 2 diabetes. 80% of people with heart disease, it's diet, smoking, things like that. So we know that a lot of this is preventable on the front end. Secondly, we know that chronic illnesses get worse over time. And we also know how to intervene to prevent them from getting worse. But if you don't intervene, they get worse and worse and end up in the hospital. So the point is that the problem is that we have a system where all the incentives are focused on the acute care of someone with diabetes or someone with asthma or someone with congestive heart failure. Very little money is spent on prevention, and very little money is spent on managing those conditions in the home and in the community rather than in the hospital. So of that $2.8 trillion, most of it is going to take care of people who are already sick. Almost none of it's going to keep people from getting sick in the first place. So let me give you an example. Let's say that you have an 80-year-old woman who has a well-managed congestive heart failure, stable congestive heart failure, and she's living in Beaverton in a little unair-conditioned apartment. And there's a heat wave like we've had this summer. So the temperature goes up to 100 degrees for a couple of days, and the temperature of her apartment goes up, and that increase in temperature puts enough strain on her heart system that she flips over into full-blown congestive heart failure and ends up in the hospital. Now, under the current healthcare system, nobody would know about her until the ambulance, until a 911 call one comes and they take her off to the hospital. Under the more rational system, we'd actually pay a community health worker to check on her on a regular basis, to make sure not only that her medical needs are taken care of, but also other things that might lead her into a medical condition. Medicare today will pay for the ambulance, and it will pay for $50,000 to stabilize her in the hospital. It won't pay for a $200 window air conditioner, which is all she needs to stay in her home and out of the medical system. The difference is $49,800. That's a lot of money. And I would argue that that's not money. That's not a benefit. I mean, it's not anything that contributed to her health. If that money was moved, let's say, to public education, and she had a home health worker, and she had that air conditioner, she would avoid an acute medical episode. She'd avoid having to go to the hospital. She'd be staying right in her home and wouldn't be sick. So really, that's the basis for what we've done with the Medicaid population. We've created something called coordinated care organizations, which are new local delivery organizations that are made up not just of hospitals and doctors and nurses and health providers, but also people who are working in the community to address childhood obesity, people who are trying to address those things that actually cause people to get sick in the first place. And we have 8 of those coordinated care organizations started operating on August 1st, and another 7 started operating 3 days ago. So now we have 15 operating that covers close to 90% probably of our Medicaid population around the state. The idea is that they will focus again on prevention and wellness. They'll focus on trying to manage chronic conditions in the home rather than in the hospital. They're operating on a fixed budget that only grows at a fixed amount per year, so there's a real incentive to reduce costs. And we believe that we can not only dramatically improve the health of the Medicaid population, but we can save literally billions of dollars. And the reason the federal government gave us $1.9 billion to help us operate this and make the transition is that they stand to save a total of about $10 billion over the next 10 years. So it's a pretty good return on investment for the federal government. And in Oregon, those resources that we're going to save will be reinvested into hopefully things like public education. So the last thing I'll say is we're hoping that if we can demonstrate over the next couple of years that this is a high-quality, low-cost delivery system that really does improve health at a much lower cost, we want to list this on our new health insurance exchange so it would be available for public employees or public school teachers or small businesses so that we can actually then begin to reduce the cost of health care throughout the state of Oregon, but more importantly, keep people healthy. The most effective healthcare dollar you can possibly spend is the one you don't have to spend by not getting into the medical system. And I can tell you as a medical doctor that even when I was in the emergency room, most of the stuff I saw was preventable. But we have a system that's not designed to do that. So I'm pretty excited about this. I know that once we get past this election cycle, and I'm not here to suggest a position on the election, except to say that the discussion has been pretty disappointing so far on both sides. It's been about sort of attacking people and not talking about sort of the things we've got to address to get this country right on track. And one of them is really health care, because we have the baby boomers, my generation. There's 78 million of us, and a year ago January we started becoming eligible for Medicare at the rate of 10,000 a day every day for the next 20 years. And so that huge number of people are going to then be being dumped into a medical system that's hyperinflationary, and it's not a good picture. We can do better. And I think that what we've done here in Oregon, if we can make it work, can in fact be a model to help us address that issue once the dust from the campaign settles. So thank you very, very much for having me here. Thank you, Senator, for inviting me, and I'd love to just hear from you and have a conversation. Thank you. Maybe we could go sit on the edge of the pit over there. Hang our legs over.
We have a question, Alice?
Yes. A lot of questions. I'm Alice Bartel. I'm a member of the League of Women Voters. I was asked to kind of moderate. It's not on? It says it's on. Do you want me to come up there? I can do that.
This reminds me of my old Channel 2 days.
Yeah.
Do you hear it now? Okay, good. Because I can stand here and you can be there. Okay, this is for the governor. What is the hardest part of your job?
Well, answering questions like that, I guess. I would have to say, for the last couple of years, the hardest part of my job is getting news that one of our service men has died in the Middle East. Just had a couple here. Service for a lad tomorrow over at Baker City, and of course we had a lad from this area. I would say that's probably the hardest part.
Thank you. And this is also for you, Governor. Senator Haas has been preaching the need for comprehensive tax reform for some time now. Can you help make him happen? Help him make it happen in the next legislative session?
I don't know about the next legislative session, but I want to tell you that I agree with him. We have an insane tax system. We have one of the highest marginal income tax rates in the nation. It's not a very progressive tax system. It's not a very stable tax system. And I think one of the reasons we're having trouble pulling out of the recession is the instability of our income tax-based system. So what I've been doing over the last 8 months has been having some very productive conversations with leadership of Oregon's business community and Oregon's labor community and other stakeholders to see if we can find common ground to have another run at trying to modify our tax system that will provide more stability and reliability, that will better position us for economic growth, and will provide stable resources to public services, particularly to our public education system. So we have done some focus groups on that, and with probably by the end of the year we'll have a proposal for us to have a discussion about. And I think the question, I think, is really timing, when we want to bring something like that before the voters. Obviously, we need to vote on something like that, and I think we need to be ready to do it. We need to have a run-up period where we can have a good conversation and people understand it. But the objectives really are to try to provide stability, try to provide a relief for people who are struggling, and to give us a better tax picture particularly for our jobs and the economy. I don't think those are mutually exclusive, and I think many people recognize today that public education is the engine of the workforce of the 21st century. So we've got to be able to view this in a different way, through a different lens, and I'm confident within the next 2 to 3 years we'll take another run at that.
Okay, thank you. Governor and Senator Haas, we all know that healthy students are more likely to excel, and students have indicated a need for more trained, culturally competent healthcare providers at their universities and community colleges across Oregon. Will you work to ensure that SB 97 or similar legislation passes in the next session? And if you know what SB 97 was, that would be helpful to explain. Does anybody remember what that is?
Maybe can you refresh my memory? The numbers get lost.
Okay, who had that question? That was your question. Okay, would you like to tell me what that was?
Yeah, Senate Bill 97 would implement healthcare providers and make sure they're culturally competent, and they have to be trained before they do healthcare. Yes.
So I still don't know what Senate Bill 87 was, but I can tell you that the point is, this is a very important point, because if you want to get at true prevention, you have to actually have culturally appropriate providers interacting with individuals. There's different cultures. There are language issues. There are a whole host of issues. And so, one of the challenges of making this work is developing a new health workforce. So you have a lot of people right now. The healthcare industry grew right through the recession, but a lot of those people were running MRI machines for MRIs that probably didn't need to be taken. They were shuffling insurance papers. So the question is retraining that workforce and providing that culturally competent, and diverse workforce that can actually be those community health workers that will keep people out of the medical system in the first place. So that's an integral part of making this work. A very good question.
Thank you. What effects will health care reform have on Oregon's children's access to health care?
So you can ask Mark a question if you want, that'd be okay.
Most of these have to do with health care, so I think you're going to get the majority
I guess
of them.
that's how the evening was billed, wasn't it?
Yeah.
So, first of all, we've done that's one area we've actually done a very good job on. If you look at sort of overall well-being of kids, Oregon's not doing very well nationally, but in terms of access to health care, because of the work that was done under the Kulingoski administration with the leadership of a number of legislators, we're doing a very good job there. This actually should expand it and stabilize it, because the CCOs essentially are integrating all of these services, and we're also in our educational reform, our early learning council, there's a lot of services on the educational side that have an impact on healthcare and vice versa. So that's not an area that I think we are at any risk of slipping on in terms of what we already have. I think, in fact, our access to healthcare for kids will probably get better under the system.
And here's kind of a related one. Oral health is a major health issue for Oregon's kids. How will the new CCOs help deal with that?
So the Medicaid, so let's remember that what we've started with here is our Medicaid population, which is the population the state's directly responsible for. The coordinated care organizations are seeking to integrate mental health, physical health, dental health, and long-term care into the same delivery model. So we're well aware of that. We just had a discussion with some of the people who run these dental organizations about the process of integrating them into the CCOs, but that's an integral part of this. And one of the things we did with the Oregon Health Plan is we began to integrate physical health and mental health and chemical dependency issues, which were at one time viewed as completely separate. Well, we recognize that if you want to be healthy, you have to recognize that that's a function of mental health, dental health, prevention, long-term care, and the idea here is to integrate all those services in a cost-effective way.
Okay. And how do continuing care organizations differ from the accountable care organizations in the federal law?
Well, the first thing, they're actually up and running. There are some similarities between the accountable care organizations. They both seek to integrate service delivery and have sort of more patient-centered care. I think one of the differences here is again that ours are actually on the ground. I mean, we've gone through the process not just of talking about them, but engaging the people and the stakeholders who have to participate in them. We've also developed a global budget so that we have essentially a spending cap. That is, we know how much they can grow each year, but we've also developed very clear metrics for quality care. So they have to not only manage costs, but they've got to demonstrate that they're actually improving the health of the population. I think one of the reasons the federal government gave us the waivers is because Oregon actually passed this legislation to create the coordinated care organizations with huge bipartisan majorities, I think like 57-3 in the House, and also created our health insurance exchange with the same kind of large bipartisan majorities. And I guess I want to just take a minute and reflect on that healthcare reform has been such a divisive, polarizing issue at the national level. And it's just very refreshing to see a state that says, wait a minute, this isn't a partisan issue. This is an issue that affects all Americans, all Oregonians. It costs too much. It's not making us healthier. What do we have to do to fix it? And I think you should be very proud of your legislature for coming together and taking that off the partisan agenda and actually producing a product that I think is quite remarkable.
Okay, thank you. Will Oregon Healthcare Exchange and accountable care organizations eventually improve options for Medicare recipients who don't have chronic conditions?
Well, this is, let's leap right into this one because, the biggest challenge I think we face in the healthcare system nationally is Medicare. And it's driven by simple demographics. We've got 78 million people who are getting older, and they're able to get publicly financed health care when they turn 65. Many of them will live 20 or 30 years longer and receive health care, that the cost of which is growing a lot faster than the CPI. So it's not a sustainable model. And unfortunately, the debate about Medicare, when you talk about reducing the cost of Medicare, the assumption is, well, we're cutting somebody's benefits, right? And so it doesn't go anywhere. But if you take that example I gave you of the woman who needed the air conditioner, I would argue that the $48,000 that would have been spent putting her in an intensive care unit wasn't a benefit. The benefit was the $200 in her window that kept her from going to the hospital in the first place. So somehow we have to reframe that debate. And I do think this is a great way to do it, because if these coordinated care organizations are providing really good care for people on Medicaid and showing a new way to deal with chronic conditions, and to get at the question how to keep people out of the healthcare system in the first place, I think that we should open that up, at least on an experimental basis, or for people who want to, who are on the Medicare program, because I think ultimately we're going to have to go to something like this. And I believe that we can, there's no contradiction between reducing the cost of Medicare and improving the health and quality of life of senior citizens.
Okay, what plans are there for those who are uninsured and need health care for catastrophic issues like cancer?
Well, again, what we did last session is sort of the first step. And the idea, again, is to prove up this delivery model and then to begin to offer it as an option that people can choose on the health insurance exchange. The idea of the exchange, of course, is to force true competition and allow you to have a sort of an apples-to-apple comparison of various health plans. And when the Affordable Care Act, if it's not repealed, comes into when it's implemented in 2014, it's going to bring another, what is it, Sean? 280,000 people under coverage. And hopefully under coverage of a new system that's not so inflationary and wasteful. So I think what we've put in place with our waivers and with the passage of the Federal Affordable Care Act by 2014, we should have reduced the number of people who are uninsured in the state just dramatically.
Okay, how would the new program impact or affect people who lose their jobs? Like employer-provided coverage, COBRA, or some way to continue their coverage? And there's another question in here talking about the cost of COBRA. For a lot of people, that's not an option.
Yeah, you know, one of the problems with the, I'll tell you what the most simple solution would be, not particularly necessarily politically popular, but to me it makes absolutely no sense to tie your health insurance to your job. It's just crazy. If you lose your job, you lose your health insurance. But what does that do? That means people hang on to jobs that they really don't like when they could move to another job, or they're trying to change their career. They're worried about losing their health care. And, unlike 50 years ago when people had one job for most of their lives, most of the kids who are coming out of high school and college today, they're going to have 4, 5, 6, 7, 8 jobs. So they should be able to move around. And I think, to me, the most logical system is to have a basic healthcare benefit package that goes with you, period, end of story. Because in this country, if you don't have insurance, we still pay for your health care. You go to the emergency room, and anyone who comes in gets treated. So we end up treating people for their strokes in the hospital and not paying for their blood pressure medication in the community. So ultimately, and I think that's gradually where we're going, is you have this basic healthcare package that just is part of being American, which is what almost every other industrialized nation does. And then if you want to take your disposable income and buy additional services, you can do that. But the people who don't like that idea, I've had many conversations with people, and I've said, so are you willing to then adopt a policy that says that if you come into the emergency room and you don't have insurance, we're going to let you die in the ambulance ramp? Oh, no, we don't want to do that. Well, you're going to pay for it on the back end or the front end. And it seems to me that it's much more honest to say, look, healthcare is something people need, particularly if it's healthcare that keeps them healthy and out of the acute care system. So that's an issue that's going to be with us as we move forward, but ultimately I think we have to disconnect medical care from your job.
Thank you. And I have a couple of questions about providers. One has to do with what do you see as the role of public health nursing and the home visits? Because the CCOs have their own folks, and is public health nursing still going to be something that happens?
Yeah, public health nursing and public health in general has been sort of the lost stepchild in the healthcare system, and that's where we've made the big gains in the health of our population. It has not been through acute care medicine, it's been through preventive care and public health measures. And so public health nursing, home visits are an integral part of this. The young man that asked the question about the culturally appropriate providers, this gets right to the heart of it. And this is an ongoing debate. I mean, we're having this conversation with the CCOs about where that workforce is going to come from. I think, but regardless of where it comes from, it's going to have to include a very, very significant component of community-based and public health professionals, because that's where the real cost savings are, keeping people out of the acute care system in the first place, and that's really what public health does.
Okay, and I have a couple of questions asking about naturopathic and homeopathic physicians, whether or not they will be included in this whole healthcare reform system in Oregon.
Yeah, in my view, we need more, not fewer, primary care providers. And I think the only litmus test for a naturopathic physician, a chiropractic physician, or a medical doctor is that they have to operate on evidence-based services, so that you have to, the care you provide has got to be backed by good evidence that it produces good outcomes. But I think there's room for a variety of providers in this new system, and I've been very straightforward about that from the get-go.
Okay. And we had a couple of questions about how, or if the CCOs are going to be able to affect premiums for folks on the exchange. Are they mutually exclusive, or how does that work?
I mean, the idea is that, again, once we prove these up and demonstrate over the next couple of years that they are a low-cost, high-quality delivery model, and putting them on the chains, they would then be an option. And if the cost of a CCO is significantly lower than the cost of a private commercial product, that would certainly create a dynamic that I think would affect rates. One of the real challenges, to be honest, that we have to work through is, I think, putting these coordinated care organizations on the health insurance exchange is threatening to private commercial insurance companies. Or, for example, ODS, which is a big company here in Portland, or Providence Health Plan, got the contract for public employees. They're concerned about obviously losing that contract if new delivery models come on the exchange. So those are the kinds of issues, though, that in Oregon we can put out on the table. We can sit down and get the people around to talk and figure that out. But I think the short answer is yes, if in fact these are able to provide good care at a significantly lower cost, that would definitely have an impact on the overall premiums.
Okay, and then we had some questions about mental health. Mental health is to be combined with physical health as well as the money. Mental health is already sadly underfunded. How is mental health to be assured of being given adequate funding?
Because we have built into the CCO business model outcome metrics or quality metrics that have to do with a whole range of services. I think the challenge really is making the transition from the way mental health is currently funded. It's primarily a county responsibility now, at least in the Medicaid population. We were able to actually get some additional resources from the federal government for that. And that's one of the reasons that we've had counties intimately involved in the development of the CCOs. And that's to make sure that we don't lose anything as we're making the transition to a more rational delivery model. But it's been very, very clear from the start, both in the legislation and in the structure of these new organizations, that mental health and physical health and oral health all have parity and need to be part of the overall delivery model and service package. And
then we have a few questions asking about single payer, if it's a possibility, and someone asked why we didn't get it in the first place.
Well, a single payer system is a way. A single payer system is a way to pay for health care, just as the current private commercial insurance system is a way to pay for health care. So there's two parts to this. regardless of whether it's a single payer or some other payer, you've got to be paying for the right delivery model. If you have a single payer system that's still paying for a system where that little old lady I told you about gets to go into the hospital and doesn't get her air conditioner, you haven't done anything. You get a one-time savings by eliminating the cost of the insurance, but you have to change the delivery model itself. I think that's the point I want to really stress is the real problem here is in how care is organized and delivered. Now, having said that, the model I just mentioned to you where everyone has some level of coverage, to me would be a single payer model. And if you look at Medicare, like it or not, Medicare is a single payer model. It all comes from public resources. It's delivered through a private system, but it is a single payer. So just having a single payer, and I'm not against a single payer system by any means, but just having a single payer, if you don't change what you're paying for, doesn't fix it. So I think ultimately in this country, we're going to have if you will, a single payer system, or a system in which everyone has some basic level of coverage that's portable, that goes with them, that isn't tied to their insurance, and then they will be able to purchase additional resources above and beyond that, or services if they wish to. That's a model that is used in almost every other industrialized nation in the world, and we are such an outlier. And instead of our single payer system is essentially the ER. Which is a pretty crazy way to provide medical care if your objective is to keep people healthy.
Okay, now I have a few questions that have nothing to do with healthcare, or a little bit to do with healthcare, so maybe somebody else can answer questions.
These healthcare questions, these are better than the ones you get from legislators. I'm very impressed.
I think we've got a very educated audience out here, so I'm impressed too.
It's like a doctor's convention or something out there.
Okay, one has to do with our PERS system. It says California has just capped their retirement system. No one wants it. At $132,000 per year. Is Oregon going to do something, or do you foresee the legislature doing anything to deal with the retirement system that we have now, and the funding mainly of the retirement system?
So this is a complicated and controversial issue, and an issue where I think people sort of demagogue on both sides of it. But here's sort of the basic facts. The benefits that the public employees have in our state were actually earned. In the late 1970s and during the recession of the early 1980s, in many cases they gave up the pay increases for a bump in their retirement. So there's a reason we got here. It didn't happen in the darkness in the middle of the night. There were rational reasons that got here. Now, what's happened over time, particularly with Oregon's system, the portfolio, the fund that pays out the benefits, lost about 27% of its value during the stock market crash of 2008. And so part of it and making up the difference then is what's increased employer contributions. So that's what increases the amount the state has to pay or a school district has to pay for that. The system still is actually very sound. If you look at the funding of the system across the country, it's one of the better funded systems. So I don't think it's going to go bankrupt. Here's the practical issue, though. The automatic increases, for example, the COLA, for people who are already retired is significant. And those resources are resources that are not available for today. So, for example, the projected increase in the K through 12 budget for the next biennium is around, if you just calculate it the way we normally do, it's around $650 million. The PERS increase benefits in general will eat up almost all of that. So you could increase the school funding budget by $600 million. Very little of that would get into the classroom to lower class sizes or provide more prep time for teachers. So there's a practical issue, and I think we have to figure out how to address that. But the way we're going to address it in Oregon is not like they address these issues in Wisconsin. We respect, at least I respect our public employees. I am a public employee, and these are people who are part of our community and very, very important to us. So this is a conversation that all of us have to have at a table when we look at the very real short-term and long-term issues with the system and figure out how to make it work, not only for people who are already retired, but for people who are currently in the workforce and for the services that we're trying to fund. And I think probably the most important one of those in terms of our long-term future is our system of public education. So that's a conversation that I think you will see playing out in the next legislature, and it's my hope that it'll be a rational, thoughtful conversation among people who share the desire to find a common solution.
And I really don't want to duck this question. I think it's important in this debate to remember that in 2003, Kulongoski's administration in the legislature passed a package of PERS reforms, and they were pretty dramatic. And without those reforms today, I don't know which one would be bankrupt, either state government or PERS, but they save hundreds of millions of dollars in tax dollars and stabilize the system for thousands and thousands of teachers, police officers, and many others. And now we're at another point where we should do more. I think the PERS board can do some things, even without the legislature. Maybe the legislature needs to force them to make some changes, but it is so complicated and counterintuitive. Lowering the guaranteed interest rate, for example, would have a short-term increase to the system, and it goes on and on and on. And it will take just that kind of a reasoned, thoughtful debate to eventually get to a place where we can cut some of these costs without cutting the deals what that people who are retired counted on when they signed up to be a police officer or a teacher a long time ago.
Let me just add one more thing, because this has become an issue nationally, sort of a flogging post for public employees. They're talking about the public employee retirement system. And if we're going to talk about unfunded entitlements, which is really what the point is, they're concerned that it's an unfunded entitlement, then every last American is paying into an unfunded entitlement called Medicare. So if we're going to take a hard look at the sustainability of the PERS system, we need to take a hard look at the sustainability of a system that's going to absorb 78 million baby boomers at these inflationary rates, and it doesn't pencil out. So somehow we have to put the pin back in the grenade on this issue and step back, as Mark says, and just have a conversation about what we want and where we want to go and how we get there together without demonizing anybody or without characterizing this and making it sort of a political football. It's an important issue, serious issue. Income security, retirement security is a very, very important principle in our country, and we have to remember that. We also have other needs to fund services for kids and people who have lost their jobs and don't have health care. So hopefully we can have the kind of conversation that will make us proud in Oregon, not the kind that drove people apart in the state of Wisconsin.
Thank you. I have a question that I don't know that the Oregon legislature can do anything about, but it's worth talking about. A constitutional amendment to override Citizens United. What is the Oregon legislature prepared to do to make that happen? And I know it's not.
Well, there's probably not a lot the legislature can do about Citizens United. But Oregon is one of 4 states that has 0 limits on campaign contributions. Bill Gates could give me $1 million for my campaign, but he can't give his own state legislator up in Redmond more than $250. And that creates a lot of problems, because you do have some legislative races where it's not uncommon for people to get $50,000 from one source. I'm sitting next to someone who ran against a guy who got $400,000 from one person. That isn't right. That doesn't feel right. We have to make some changes here in our speech provision to set those limits. And the only way we can do that is through a change of our Constitution. I proposed this before. It's a very heavy lift at the legislature. It's even heavy for voters because people don't like to mess with their Constitution. But we have a speech provision that's interpreted more broadly than the federal Constitution. I would support changing out speech provisions with the federal constitutions to allow us to at least set some sort of limits so that we don't have sort of our own many Citizens United here, and we can end this once and for all, these huge contributions into certain campaigns.
And this one has to do with education. Just with the savings you see with the new healthcare system, will you take a closer look at education and what school districts are facing with the kind of funding the state provides?
Well, maybe take a cut at this. This is an area, Mark chairs the Education
Yes.
Committee, and this is an issue that's been near and dear to his heart. Public education is underfunded at all levels, from early childhood through post-secondary education. There's no question about it. We've set some aspirational goals in the state that actually the kids who started school today, the kindergartners who started school today, are the class of 2025. And that's the target date. We've said we want 100% high school graduation rate, and we want 80% of those kids to get at least 2 years of post-secondary education training, and 40% of them to get a baccalaureate degree. We're not going to do that, no matter how innovative we are, without significant additional resources put into our public school system. We need to lower class sizes. We need to spend more on early childhood to make sure the achievement gap is erased before kids get to school. We need more electives, particularly in the vocational area in high schools, to keep people different career paths. We need a lot more capacity in our post-secondary institutions for them to absorb all these kids. So clearly, I can argue that we were able to put an additional $250 or $240 million into healthcare, into education, because we reduced that much in our healthcare budget this last 2 years. And if we can continue to bend down the cost curve, that will help. I also think, though, we need to have that public finance debate again, because we're going to have to make a significant investment in our educational system. It's so clear that, when I got elected in Roseburg in 1978, kids could drop out of high school in the 10th grade and get a great job at Roseburg Lumber with good benefits and a good job and the expectation to have that job the rest of their lives. Those days are gone forever. There's a connection between your educational level and your ability to actually get and hold a good job. And so this is absolutely critical. And there's nothing more important that we can do in this state than A, adequately fund education, and B, fund the system of education that was designed for the challenges of the 21st century, not the middle of the last century. So more funding, right system, got to do it.
The governor and I have been working on, down in the weeds on education in the 11 through 14 spectrum of the preschool to graduate school. And what we would like to do, in sideways answer to the funding question here, is to give more opportunities to high schoolers in 11th to 12th grade to earn college credits, so that those with affordability would be the play there, so that those families and those students would have a more affordable college education. It also hooks, research has found, more kids into college. The only problem is in Oregon is not that we're doing it, it's just not enough kids participate. 20 to 30%, it goes up and down in various school districts. It is expensive, and but there's a 1 + 1 = 3 component here, where it's a win for schools, it's a win for students certainly, and it's a win for taxpayers. And so that's one of the ways that we're trying to get more bang for the buck here in lessening the costs of education, particularly in those high school years. And we've been hearing for a long time, some of you have kids, some of you may even remember this when you were in high school, the 11th and 12th grades are not the most productive years in the K through 12 career. And it makes a lot of sense to me to have those kids taking courses at community college or taking AP or IP courses here at school and earning credits so they can take them down to OSU or PCC and be a quarter of the way home towards a bachelor's degree or halfway home to an associate's degree.
And that leads me to the next question is, what are you doing to keep costs down at our colleges and universities? And people are really concerned about the amount of debt that college students are graduating with.
Well, there's a interesting story here. Mark was talking about the veterans and the flag at the very beginning. My dad was a GI in Patton's Army and entered Europe through Normandy and marched all the way across Europe to Berlin. And when he came home, this nation rewarded him with a free college education under the GI Bill, which I think was one of the greatest social programs of the last century. It raised up a whole generation of Americans and gave them the opportunity to excel, many of them, the first person in their family to go to college, and that led to all the innovation and the technology of the 60s. It led us to the moon, and we paid that back many times over in terms of their higher earning power. And that was in 1948, 49, when you didn't need a college education to get a good job in this country. That was the height of the manufacturing industry. That was the path for the middle class, was through manufacturing. And today, when we know, we just talked about it, we know that there aren't those kinds of jobs out there, that you can't get that kind of job, a family wage job with upward mobility with only a high school education, or at least it's very, very difficult. At a time when we know that, we're burdening our kids with $30,000, $40,000 debts just to get a bachelor's degree at a public university, which doesn't make any sense. It's counterproductive. So one of the things we're looking at, and again, this is, there are no non-controversial choices today, particularly having to do with money, but next session, we're going to have a big, significant expansion of our bonding capacity. That is the amount of debt or bonds that the state can sell. The legislature back in the early part of the last decade, or this decade, the last decade, bonded to help balance the state budget. We had to pay those off. It wasn't very good policy. We had to pay those off over 15 years. That's now paid off now. So one of the things the Treasurer's looking at is an act that would significantly take a chunk of that, the first biennium, and begin to build up a corpus that would dramatically expand the ability to provide resources for kids going to college, and then take a smaller portion each biennium for the next 5 biennia. So essentially build up a fund that would ensure that, at least at an Oregon university or community college, you wouldn't have to rack up that kind of debt. I think the federal government needs to be a much bigger player in this at the end of the day. The federal budget spends only about 3% of the federal budget on education, and 3% on surface transportation, I might add. So, but I do think that there's some things we can do, but I think we need to continue to highlight the importance of that college affordability in order to actually get where we want to go economically and socially.
Okay. And last question. This is kind of this does involve healthcare. Do you see that our healthcare system can be used to attract new business to Oregon with our healthcare reforms?
The short answer is yes. When we reformed the Oregon's workers' compensation system in the late 1980s, over the next decade, actually 2 decades, Oregon businesses saved about $14 billion. And we still have one of the lowest workers' comp rates in the country. If we could lower the rate of medical inflation for private employers to the same level we're planning to do it in the Medicaid population, it would be billions and billions of dollars in savings, and it would be a huge competitive advantage to do business in the state of Oregon. So I think there's a real economic development advantage here too, if we can actually drive those costs down. It's a very good question.
Well, I have to say that I am very impressed by these questions. I am not surprised by the thoughtfulness of the people in this community at any town hall, but I very much thank you for your thoughtful questions, your listening, and I want to thank you, Governor, for joining us, for coming down here, walking the mean streets of Beaverton and hanging out with us for a while. Thank you very much. Please join me in thanking Governor Kitzhaber. Good night.
friend Mark. So
I'm a friend of Mark's too. But I was thinking, wow, is it new media here at all? Media, you know?
let's see, Shady Wells from Beaverton Daily Times is reporting. He's the only other media person I saw.
It's unfortunate. Isn't that really unfortunate? I'm just saying, making a general comment here. Something like this, community forum, on such an important subject,